And I studied a lot of techniques, and I'd come back to my practice and I'd go, right, this is great, I really like what I learned, I'm going to start using this new technique. And so I changed what I did with my patients. I changed it quite completely, and my patients go, oh, have you been to another seminar, have you? Learned a new technique. It's like, yeah, well, look, I think this is really good, and we're going to give it a try. Of course, you don't really know until you try it out, but what I discovered was that all the techniques had some things that were good, and they had some things that were bad. Some had more good things than others, and some, had not much good stuff at all. But the only way I found that out was by trying them out. And then I reached a point where, I don't know why, but suddenly it was drawn to my attention, the idea of taking pre and post x-rays, of taking an x-ray after you've been seeing a patient for a period of time. And it was really strange because it was this thinking out of the box thing like Hakan was talking about this morning when we were at college. We were taught to take x-rays to check their spines. It was a bit different to the way you guys are taught. I think we used to take x-rays on pretty much everybody who came in to the student clinic or every adult. I think it was so we could practice our x-ray taking technique was part of that. And we'd take this x-ray and we'd look at it and we'd say, yep, you've got this problem, we can see it on your x-ray, and then we're going to give you chiropractic care. And after doing this for a few years, I sort of didn't realise that it was pretty stupid to find a problem on an x-ray, tell a patient that you'd found their problem and show it to them on x-ray, give them a course of some kind of care, and then not take another x-ray and tell them that the problem was fixed. It suddenly dawned on me and I realised, well, that's really dumb. If you're going to find a problem on an x-ray, you show it to the patient, there's your problem, and you do a course of care to address that problem, you've obviously got to go back and retech that original test to see that you fixed the problem you set out to fix in the first place. So I started taking comparative x-rays in my practice after I've been practicing for about 5 years. And I got some good results in some cases, and I got some no changes in other cases, and I got some cases that had actually gone backwards on their x-rays. And that was very difficult to do. But when you've been in practice and you've got patients you've been seeing for years, and you've got a relationship that you've built with them, to then go and take x-rays, find that they're worse, and show them to the patient, and they say, well, doesn't that look worse? You say, yes, it is. That's why I want to take the x-ray. So I had some patients who left. Definitely, they said, well, I've been seeing you for 3 years, and I looked at x-ray, and my son's worse, or I'm worse, or I haven't got better. What have you been doing? You've been wasting my time. Now, previously, they were very happy because they felt a lot better. But when they looked at those x-rays and saw the x-rays weren't improved, they were really, really pissed off. Some of them were like, well, I'm really glad that you stepped up and you were prepared to go out on a limb and do that for me. I really appreciate that. I know that was a big thing to do, and that's great. And what do we need to do to correct this? But certainly the first step to getting good at correcting spines is you've got to take a before x-ray and an after x-ray. And then you've got to look at every case critically and assess how well you've done. And sometimes you'll do well and sometimes you won't do well. The cases where you do well are not really the ones you learn from, though, are they? It's the cases where you do badly is the ones that you learn the most from. They're the most painful, and they're the ones that are going to teach you where you're making mistakes. What I found when I started taking those comparative x-rays is that there were certain patterns that I was not getting good results with at all. There were some patterns I was getting reasonable results with, not great, but reasonable, but some I just wasn't at all. But then I realised that obviously I had to learn more techniques to improve the results I was getting. So that's why I started studying CBP. Now, there are a lot of very interesting techniques in chiropractic. There are some chiropractors who do acupuncture. There are some chiropractors who do emotional techniques. There are some chiropractors who do pretty much anything you can imagine. Some have a very strong focus on nutrition. And whilst I believe that all of those modalities have some kind of validity, it seems to me that if you're a chiropractor, that your number one objective needs to be to get good results with correcting crooked spines and taking them to a healthy, normal alignment. If you can't do that as a chiropractor, then I think you're missing the boat. So I believe that that's really one of the most important things that you can do. Today, Pete's mentioned a couple of times the work that's been done by Dr. Deed Harrison. Hasn't mentioned so much, but his father, Dr. Don Harrison, has done at least as much and probably even more. He was the one who really started the whole application of mechanical engineering principles to the human spine. And it sort of upsets me to hear that you as students haven't heard of the work that they've done, because Deed Harrison on his own, I think it's got, is it something like 80?
120, I think.
120. He's either lead author or the co-author on 120 papers that are published in peer-reviewed journals. So we're not talking about obscure journals, we're talking mainstream peer-reviewed journals such as Spine, Journal of Orthopedic Research, major peer-reviewed journals. And they developed a technique which is called CBP, and they've done an enormous amount of research that's published in leading journals, and there's no other technique that comes even remotely close. In fact, I think if you were to take all of the papers that have been published on diversified, there probably wouldn't even be 50. Papers that have been published in the entire history of diversified, and that's a very non-specific kind of a technique anyway. You look at all of the other techniques that are out there, and most of them are lucky if they've got a single research paper that's published in a major peer-reviewed journal. So if you're studying scientific principles and you're studying science as the foundation of what you're doing in your chiropractic, it seems to me that it's absolutely critical that you be looking at the work that's been done by the Harrisons and people they work with, Haas and Trajanovic. And these books are an excellent distillation of their work. Because the papers themselves, whilst they're great reading, they're hardcore, and if you're into reading research, then read them, and at some point, you'd probably be worth reading them. But to get yourself started, these books are just absolutely worth their weight in gold, and I couldn't recommend them highly enough. As a student, I could not recommend these highly enough. Not only will they raise your understanding of what you're doing in chiropractic so you'll get much better results for your patients, probably even more importantly, raise your understanding of chiropractic so that you have a better grasp in your heart of what it is that you're doing and what you're capable of doing and what you're capable of delivering to your patients. So I couldn't recommend these books highly enough. I think that it would be very valuable for you to learn. And what Pete's been wanting you to take home from this is that if you get the right methods and you get the right tools, then it's very possible to have a very efficient practice that's very rewarding, where you get amazing results for your patients, where you get lots of hugs and kisses, and you get to have good financial return for yourselves as well. You can do it the hard way and find out, many years down the track, like many of us have, including myself, or you can do it the easy way. So, take advantage of the resources that are out there for you.